Welcome to Pathway to Compliance. My name is Lisa Dubrock, and I'm one of your hosts today. I am sitting here with Brianna Rhue from Dr. Contact Lens, and we're going to talk a little bit about compliance in her area of expertise, which, trust me, is vast. And so why don't we just get started? Brianna, can you tell me just a little bit about who Brianna is and how you came to think that Dr. Contact Lens is what you needed to start as an organization?
Yeah, so I am an eye doctor on the side, Lisa, but most people in my industry know me as a tech and a practice management doctor in typically purple. I'm in blue today because I saw patients and my purple scrubs were dirty. But I bought a practice and scaled it in 6 years from $750,000 to over $2 million. I've also built 2 tech companies. I'm a mom of 2 boys with a husband as well. But in the beginning, like many people who are
3
starting
boys.
businesses, right? 3 boys. I struggled with delegation and learning really as a physician when to ask for help from my team by thinking I needed to be the one to do it all. I'm on a mission. That's why we're on this podcast today, to keep every contact lens prescription in the hands of the doctor who wrote that prescription and away from online retailers so patients can live their best seeing lives. But at least I'm on a bigger mission to help every doctor step into that CEO role of their clinics and be the doctor and not the employee inside their own companies and really leading like CEOs of the future that we all need our healthcare professionals to start doing.
Excellent, excellent. When we talked a little bit before, you kept stressing integrity of the trust from your patients as well as the integrity of the data you're collecting. So talk to me about how integrity and compliance go hand in hand for you.
Yeah, when you're on that patient side, I mean, I've been a patient. That's actually how I got into becoming an eye doctor. I became an eye doctor in 2nd grade. When you go to a physician with your parents or with your little kid or whatever it may be, you are the owner of your own health record. And wherever that data is going, it needs to be nurtured and used for your benefit as the patient. And so compliance, I don't take it easy. I don't take it lightly on the honor and respect that data and that knowledge brings.
Okay. And so with regards to the data you're collecting talk to me about that data and how you're making sure that it's secure, that your patients know that it's not everywhere.
Well, I know, Lisa, anything is anywhere. I got a
Yes.
crazy spam call right before this, saying I was part of this scam. Your information's out. So with the rise of these large language models, especially in medicine, it's getting really good where you can take your own record and get some of your own answers. So I'm a big proponent as a physician that we don't have a reason to say really no to a patient right now. So it's more of an I don't know, spelled KNOW, disguised as a no. So I'm a huge advocate on patients. This is your data. This is your life. You need to be primed with questions to ask because we are busy. We have to see more patients than ever before because we're not getting paid appropriately. And that's, I think, where knowledge really is power and data really is power. So whose data is it? Because if you talk to the EMR companies or the electronic medical record companies, they say it's theirs. So if we try to convert over to another entity, you're locked out.
Yeah.
And now that patient who at the end of all of this loses are patients. So it's up to you to decide how you want to do business. You are a healthcare consumer. So if you want your data and you want to, for Dr. Contact Lens, you want to be able to order at 9:00 at night, you 100% should be able to. But realizing in the eye care space that That's 5% of what I do is get your prescription.
Right.
I'm looking at hundreds of other diseases in an instant. And that's the end point. So that's where I get passionate about your data as a patient. And then sometimes you're a patient and sometimes you're a consumer. So especially in eye care, you're wearing both hats in my practice, right? When I'm seeing you as the doctor, you're a patient. When now I'm hoping for you to get the best vision possible, we maximize your benefits, we maximize your rebates, we do all of those things, then you're now a consumer in my office or my business. So it's knowing where we sit. Dermatology is very good at this. Dentistry, any healthcare provider at their core really does care. And we're being really siphoned by a lot of these entities.
So then how do you get the patients to change their frame of mind? From being the passive, I just came to the doctor and you said, okay, and I go, okay, and I walk out the door, to taking that more active role in their own healthcare.
I again, I don't think anybody with the rise of large language models, you can no longer pretend not to know. So you can get a diagnosis of diabetic retinopathy. We all know what we need to do to be healthier. Move more, eat less, be off of screens, be outside. It's not magic, guys. So this is about health span. It's about living as long as you can, as healthfully as you can. But we need more of these systems to be interconnected. Because Lisa, we were talking like, your data's in this one, your data's in that one, your data's in this one. Like none of these systems are talking. And that's really frustrating because then you just give up. Is it easy to make an appointment? So like in women's health, right, you're supposed to have a mammogram every year over 40. How easy is that to make an appointment? It's not. So then a lot of the times, because we're healthcare consumers, that's why you're seeing the rise of all of these concierge medicine doctors and all of these things. Because you pay for it and you get that quality of service and that quality of care. And I'm not saying like in these other types of practices you don't, but it's where do you want to set yourself up as a patient?
I'm going to take a little bit of a pivot and talk a little bit to you and ask you about the rise of these LLM models, and we're talking AI here and those models. What are you seeing within your world as being some of the biggest risks in how not just you, but you and your constituency are approaching these LLM models and dealing with them? And what are those risks?
I see all of this as an opportunity. I'm not in the scare business at all. So yeah, everything comes with a risk, right? So there's a risk and a reward benefit. What we need is obviously we can really feed better studies. We can move faster than ever on the data that gets put into these. The data has to be good. So, and you have to be able to be found. But if you're as a physician and you're asked to run a business and you're asked to do all these other things and another type of player doesn't have all these same regulations and put something else out there, you just have to question and verify and that human in the loop element.
Yeah.
Right. So I'm seeing it. Patients are coming in like better armed with things than ever before. And that's great. So that also is I have to stay up on things more than ever too, which is fun because it's moving fast. So I'm just looking at this. Are you a lifelong learner? Are you a lifelong patient? That's important right now and will be for decades from when this is aired.
Okay. All right. And you brought up compliance. So does regulatory compliance, is the compliance environment changing quickly for you, or what has been changing?
I mean, obviously, the information we have on a patient with HIPAA compliance and the PCI compliance and all of these other pieces that run into a clinic, it's a lot, right? So
Yeah.
you have to make sure your staff is trained on HIPAA compliance. You have to make sure, but again, all of this is already out there.
Yeah.
So it just can't fall into bad players' hands. So I wish more people, more patients would take their appointments more seriously, right? Because you are paying for that time with me.
Mm-hmm.
So I saw something the other day and it was like a doctor's visit, right? As a physician on this side. So let's say you had 25 Zoom meetings from start to finish. You didn't know the agenda and you had to solve every single thing by the end of that 15-minute meeting before you go into to the next meeting. That's what we do every day. Like
That's exhausting.
it is. And so that's where we need more of these things to work together. Like a patient
Okay.
snapshot is important. Getting a case history. Like I know people fill out these forms, right? Paper forms. So like fill out your forms online. That's so helpful, right? All of that is compliant. All of that goes in to our EHR systems, which is better to serve you. So that's where on this side of it, I I think we're putting so many regulations in place that actually don't make sense anymore.
Okay.
Which is it's a good and a bad thing. Like I think
Right.
we have to be on this level of progress or we will be left behind.
Regulation usually is a trailing thing that happens. It doesn't usually lead to the charge, but it does trail, and sometimes by quite a bit. So, Dr. Control Lens or contact lens, does it interact with these EHRs and other systems? And how do you make sure that that is a smooth connection?
Yeah, so we have the integrations with these EMR systems. So why it was created was Lisa, again, you would come in to me, see me as your eye doctor. I want you to order from me, number one, because I am less expensive. We're going to maximize all of your savings and get you the right lenses. So they're not like, third party lenses. Like I know what you're getting because I've seen bad stuff happen there, right? I know you're
Yeah.
compliant. So there's a compliance thing on patient care. Like, are you doing what I'm saying? Or you're coming back in a year and be like, that was bogus. No, I never did it, right? Because we want you to be successful as patients. And so this was a conduit to, if you did leave, send you a text message, allow you to keep a copy of your prescription digitally, but then be able to order at 9 o'clock at night, at 2 in the morning, 5 in the morning, in the afternoon, whatever you want, get you the lenses that I know are correct, validate it, and away you go.
Well, I'm personally the 2 o'clock in the morning person, so trust me.
I see you guys out there.
So I do appreciate that. So what do you think the future of healthcare compliance is going to be, and specifically within, your environment?
I mean, the future of healthcare compliance is already on your phone. Like this is your
Okay.
medical record without you even knowing it. Wearable devices, the Aura rings. Like what are these people doing with all of this data? Who's actually like caring about it? Again, we are, and this is like a nation thing, right? You go to Europe and you go to these other places that have stronger regulations in food and exercise and kids on devices and all these other things. And we're just so far behind. We're really far behind. So with the rise of like GLP-1s and making sure people are, again, this is about compliance, but we know what we need to do. This is your health record. It tells you if you're in AFib, it tells you if you're staring at your screen too long, it will move away. Like, that is the future of medical records. They have
Okay.
everything.
Okay. And then if you had one piece of advice for me as a patient or me as a vendor to you, what would that one piece of advice be?
Be part of the build. Be part of your health record. Like, you are, at the end of the day, responsible for yourself. So be responsible for yourself, right? Seek out help, ask good questions. Like, and like from the doctor role too, I love questions. I love having those types of relationships with my patients. And I love seeing like action being taken. So, and we test patients too. Like, how serious are you about this?
Mm-hmm.
But we can't always have a lot of those conversations because, again, what we're getting paid on the back end, it's not mathing, Lisa. It actually is not mathing.
Okay.
So I recently have seen a lot of my 60-something plus patients, a lot of their doctors are starting to retire earlier than ever before
Mm-hmm.
because of all of these things we're talking about here. The mass paperwork, the mass prior authorization, all the hoops we have to jump through to get a medication approved. So it's easier just to not do it and not help you. So who ends up losing in all of that is the whole system.
Yeah. How do you make my life as a patient easier, but also hold me more accountable?
Right. And I just don't think we have enough time to get all of that out. So that's where you're seeing the rise of this like middle software, like Dr. Contact Lens, is helping. These are businesses at the end of the day. They are not practices. They are healthcare businesses. Yes, there's more compliance around that because we are treating humans.
Yes.
You want this level of compliance. So I look at compliance very like on many different fronts.
Yes.
Because the word has a lot of different definitions for it. But yeah, I want patients to be part of that.
And, Brianna, I want to thank you today for your time to give us just a little bit of insight into Dr. Contact Lens and the compliance challenges that you have with that practice. And do you have any last words of wisdom you want to impart before we sign off today?
Lisa, I know we've been talking here for about 20 minutes, and you interview a lot of people. Awesome. What's your biggest takeaway from our conversation over the last 20 minutes?
Yes.
I'm going to flip the script here a little bit, lady.
So I'm going to say compliance, but that's my heart and soul, right? But for me, it's understanding as a patient. I was just at the dentist yesterday. They're going to submit an insurance claim and they're going to do this and I have no idea what happens the minute I walk out the door. But you have given me insight that I've never had as to what happens in that chain of events after I walk out the door and schedule the appointment that I'm never going to keep in 6 months that I'm going to have to reschedule 4 times before I actually get there the next time, right? So that has been so beneficial to me, but your compliance challenges are huge and we don't think about it. As a patient, you don't think about it. So to me, this is opening the door for the patient, which we desperately need. But I think also it proves to your environment, your ecosystem, how passionate you are about your business and doing right by the patient as well as the doctor community and every community in between.
Yeah, I love that. That's a great takeaway.
Okay. So thank you again. And I appreciate your time today.
My pleasure. Thank you, Lisa.